Imagine waking up every morning feeling exhausted, even after a full night's sleep. You're not alone. Over 50 million adults in the U.S. and an estimated 936 million people worldwide suffer from a condition that silently disrupts sleep and puts their health at serious risk. This condition is called sleep apnea. Sleep apnea is a serious sleep disorder where your breathing repeatedly stops and starts during sleep. The most common type is obstructive sleep apnea, OSA, which occurs when the muscles in the throat relax excessively during sleep, blocking the upper airway. These pauses in breathing can last from a few seconds to over a minute, happening dozens, even hundreds of times each night. Every time it happens, your oxygen levels drop, forcing your brain to jolt you awake just enough to start breathing again. The result? Fragmented, poor quality sleep that leaves you feeling drained, foggy, and fighting to stay awake during the day. This constant cycle quietly exhausts your brain and body, turning every night into a hidden stress test for your health. Here is the deal. When your oxygen levels dip repeatedly during sleep, your body goes into alarm mode. Your heart rate spikes, blood pressure rises, and stress hormones surge. Then your brain jolts awake to save you again and again, night after night. You may never remember it, but your body does. Over time, this nightly strain damages blood vessels, accelerates inflammation, and even impairs brain function. That's why many people with untreated sleep apnea feel mentally sluggish, irritable, or forgetful long before other symptoms appear. Think of it as your brain running a marathon every night without rest or recovery. Now let's make this personal. Ask yourself these quick questions. Do you often wake up tired even after a full night's sleep? Has anyone told you that you snore loudly or stop breathing during sleep? Do you struggle to stay awake during meetings, driving, or quiet moments? Do you wake up with headaches, dry mouth, or brain fog? If you answered yes to 2 or more, it's worth discussing with your doctor or scheduling a sleep evaluation. Remember, sleep apnea isn't just about poor rest, it's about protecting your brain, heart, and long-term health. If you recognized yourself in any of those questions, here's the truth. The danger doesn't stop at lost sleep. What happens during those nightly pauses in breathing silently affects your heart, your brain, your kidneys, and even how long you live. Be aware that sleep apnea isn't just about restless nights, it's about survival. Every pause in your breathing sends a ripple of alarm through your body. Now let's uncover what's really happening inside your body when sleep apnea goes untreated. Untreated sleep apnea doesn't just disrupt your sleep. It can lead to serious health issues. Research has shown a strong association between obstructive sleep apnea and various cardiovascular problems, including hypertension, coronary artery disease, heart failure, kidney disease, stroke, and even sudden cardiac death. But the dangers don't stop there. Each time your body gasps for air, your brain feels it too. A study published in 2023 found that obstructive sleep apnea contributes to cognitive decline in older adults due to reduced oxygen levels during sleep. So when you think about sleep apnea, don't just think about snoring or feeling tired. Think about your heart fighting harder, your brain starving for oxygen, and your body quietly aging faster than it should. That's why this condition deserves your attention tonight. But here's the real danger. Millions of people are living like this every night, completely unaware. They think they're just tired or that snoring is normal. In reality, their body is silently fighting for oxygen while they sleep. And the scariest part? Despite these serious risks, sleep apnea often goes undiagnosed. In the next section, we'll uncover why this silent epidemic goes unnoticed and what subtle signs your body might already be showing. Sleep apnea is more common than you might think. In fact, it's estimated that nearly 32.2% of adults in the US have obstructive sleep apnea. However, a significant number of cases remain undiagnosed. A study in 2025 estimated that the corrected prevalence of obstructive sleep apnea was approximately 2.1 times higher than the diagnosed prevalence. In fact, every night, millions of people around the world are unknowingly suffocating in their sleep. Their bodies fight for oxygen, gasping, snoring, choking while they dream. Yet when morning comes, they simply say, "I didn't sleep well." This underdiagnosis is dangerous. Without proper treatment, the damage accumulates silently to the heart, brain, and metabolism. It's not just lost sleep. It's years of your life slipping away without you realizing it. The underdiagnosis of sleep apnea is particularly concerning among women, where up to 90% of cases remain undetected due to subtler symptoms. And here's why this crisis is so widespread. Sleep apnea doesn't always look like what people expect. Many don't snore loudly. Some just feel tired, forgetful, or moody. Others develop high blood pressure or depression without realizing their sleep is the missing piece of the puzzle. In clinical practice, I've seen countless patients who lived for years thinking their fatigue was just part of aging, but when we tested them, the truth was startling. Their oxygen levels were dropping dozens of times every hour, night after night. But here's the good news. Awareness is the first step, because once you recognize the signs, you can take control and even reverse the damage before it's too late. Okay, now that you know how dangerous sleep apnea can be, the next question is, how do you know if you have it? Most people miss the signs because they seem so ordinary, so easy to dismiss. Recognizing sleep apnea can be challenging, but certain signs may indicate its presence. If you often wake up tired with morning headaches, dry mouth, irritability, or forgetfulness, these are not just signs of bad sleep. They may be red flags that your brain isn't getting enough oxygen at night. Other common symptoms include loud snoring, choking, or gasping during sleep, and excessive daytime sleepiness. Sleep apnea can also reveal itself in your blood pressure. If your numbers stay high despite medications or spike at night, that could be your body's SOS signal that it's struggling for air during sleep. Imagine waking up truly rested, clear-headed, energetic. That's what treating sleep apnea can give you, your life back, one night at a time. Here's the truth from a physician's perspective. Sleep apnea is serious, but the good news, sleep apnea is treatable. And recognizing it early can completely change your quality of life. The first step is awareness, recognizing the signs and understanding the hidden risks. The second step is evaluation. A sleep study, either at home or in a clinic, can confirm the diagnosis. Modern treatments have come a long way, from simple breathing devices to custom dental options, and even surgical procedures when needed. The key is getting properly evaluated. Proper treatment restores oxygen, protects your heart, sharpens your brain, and gives you the energy you've been missing for years. If you or your loved one snores, stops breathing during sleep, or struggles with unexplained fatigue, ask your doctor for a sleep study. It could be the single most important test you'll ever do for your heart and brain. If you found this information helpful, be sure to like, subscribe, and share this video to raise awareness about sleep apnea. And don't miss our next video on treatments that actually work, where we'll explore proven ways to manage and treat sleep apnea effectively. Also, check out our other videos on sleep and wellness to help you and your loved ones sleep better and live healthier lives. Thanks for watching.